A nurse in a hospital ward for a patient with a cerebral vascular accident is mobilizing a patient who does not wait there. The team leaders say it is kinder to lift the patient than make them wait for waste to be available. What action does the nurse take? Option A is say no and allow another team member to help lift the patient. Option B is do what their team leader suggests as they are senior. Option C, do what they suggest because they are correct in their decision. Option D is refuse to assist until a waste is available. Discuss with their manager afterward. So you can pause the video and you can think about the answer and you can answer the question. Answer is the D, refuse to assist until a waste is available. Discuss with their manager afterward. Because as a nurse, you are responsible for your patient and you have to take care of your patient in every aspect. So you cannot say no and tell another member of the team to do your job. And it is not always necessary that senior member of team leader decision is correct and you have to do the things that is told by them. As a nurse, you have to act legally and ethically and you can refuse if you think that it is not correct to do. So the answer is D. You can refuse to assist until the waste is available and you can leave the patient when the waste is available. What is the medical term for weight loss in a cancer? Option A is cancer weight loss. Option B, cancer malnourishment. Option C, cancer cachexia. Option D, cancer anorexia. Answer is C. So let's see from the option A. So option A is a cancer weight loss. So we cannot say that cancer weight loss for the person who has lost the weight in the cancer. And option B is a cancer malnourishment. So the person only has weight loss, not the like malnourishment. Person has not diagnosed as a malnourishment, so you cannot say cancer malnourishment. And option D is a cancer anorexia. So it's different word. Anorexia means the lack of appetite for the food. So the correct answer is cancer cachexia. The drug hyoscine hydrobromide is used to add which common end of life symptom? Option A is respiratory secretions. Option B is hallucination. Option C is incontinence. And option D is pain. Answer is A, respiratory secretion. So the hyoscine hydrobromide is particularly used in a patient of end of life care with having excessive respiratory secretion to reduce the respiratory secretion. A nurse has a safeguarding concern and she is unhappy with the response of the nurse in charge. What action do they take? Option A, discuss it with the local safeguarding leader. Option B, discuss it with another member of multidisciplinary team. Option C, discuss it with a friend. Option D, stop investigating the concern further. Answer is A. So if the nurse has already talked about the safeguarding concern to the nurse in charge and she is not responding to the concern properly, in this situation you can talk to the safeguarding local safeguarding leader and they are going to help with the safeguarding concern. Discharge problems occur when patients are option A, waiting for assessments, option B, waiting for investigations, option C, waiting for medications, option D is waiting for carers. Answer is A, waiting for assessment. So the discharge planning is started when the patient get admitted to the hospital and if a still patient is waiting for the assessment that cause the problem with the discharge because if the patient has not assessed by the doctor or the nurse, so the patient has not identified with the problem and that might affect with the planning of the discharge and that cannot decide when the patient will get the discharge as the patient assessment has not completed, so that may cause the problem with the discharge. A nurse visits a client who has type 2 diabetes and observes that he is unable to cut his nails. To whom does the nurse refer the client? Option A, the diabetic nurse. Option B, the pediatrist. Option C, the general practitioner. Option D, the occupational therapist. Answer is B, the podiatrist. So the podiatrists are the medical specialists to help with the problems that affect the feet or lower leg. So as a nurse, you have to refer the patient with the nail problem to the podiatrist. What does the nurse use to dress a wound that is blistering, clean and has little exudate? Option A. Non-adherent dressing. Option B. Silver impregnated dressing. Option C. No dressing required. Option D. Hydrochloride or foam dressing. Answer is A. So if the patient is having the wound that is blistering or clean and has no or little exudate, you can use the non-adherent dressing. The CARE Act 2014 is the government legislation that deal with option A. Protecting and safeguarding children. Option B. Protecting and safeguarding adults. Option C. Protecting and safeguarding carers. Option D. Protecting and safeguarding children and adults. The answer is D. Protecting and safeguarding children and adults both. A cardiac patient feels faint, has a pulse of 150 and a respiratory rate of 40. What is the nurse action? Option A. Set the patient upright and encourage slow deep breathing. Option B. Ring the emergency alarm bell and stay with the patient and keep reassessing ABCDA. Option D. Provide oxygen and request an urgent electrocardiogram for the patient. Option D. Contact the emergency doctor via the system in the hospital. Answer is a B. So as the patient is having the cardiac problem and the patient is feeling faint, has pulse raised, and also the respiratory rate is raised is 40. So in this case, as a nurse, you have to ring the emergency alarm bell and you have to stay with the patient to monitor the patient condition and keep reassessing ABCDE, airway, breathing, circulation, disability and exposure of the patient. A nurse has a patient in isolation. Where are the clinical notes kept? Option A, on the patient table. Option B, in a rack on the wall outside the room. Option C, at the nursing staff station. Option D, at the end of the patient bed. Answer is B, as the patient is in the isolation, so you cannot keep any documents inside the room of the patient. So you have to keep in a rack on the wall outside the room of the patient. Thank you for watching. Please like, subscribe and press the bell icon to get more video.